Välkommen Kris.
Ja, tack. I'm going to shock you all because I will speak English. Shameless. But I will try to speak proper English and speak slowly. On my many travels to Sweden, I have learned that there is one very secret story in your country, and that is fika. And I know that fika is somewhere very close to heaven. So I will try to get you on that road to heaven very quickly. So we're on this travel together, and I will do my best. I will make sure that you get there soon. So I have deleted 8 of my slides. Don't worry. If you want to know more about this project, at the end of my presentation there is a website, but there is also some very nice bands there, Triforces, red bands, which you are welcome to have. This is my card, it's the project's card, it's the entrance to another world, a virtual world, but you're happy to have it and I'm happy that you have it, so please go ahead and take one. So I will be talking about medics on the move, people traveling, right? So medical professionals. I am talking about a project which has started in 2006, so we're celebrating a birthday today, it's 5 years on. And I'm talking about something which is very close at our heart. It's communication. Communication is about people. It's about how people get together and how people survive together. And we know that in communication, who you are, the color you have, how you speak, how you behave is really important. In medical communication, we know that the quality of the doctor-patient relationship depends very much on race, ethnicity and language, and that even health outcomes are determined by it. A good communicative doctor will help you to become better as a patient. A good communicative patient will make the doctor also a better doctor. Now, in reality, we also see that in Europe, but it's all over the world, but it's especially significant in Europe now, that there is a lot of mobility among medical staff, and it's on the increase. That means that we get more and more doctors who speak another language than the people around them while they function in their profession. In 2009, 29% of medical doctors in Sweden were born outside of Sweden, and this number is rising every year. Sweden is very good in that respect. Of course, it's top of the bill. What consequences does this have? Communication is important, and we see different intercultural perspectives occurring. Well, we run a risk of not so good communication, possibly miscommunication, and this has an effect on the person. It has an effect on the professional because it can reduce the professional status of the practitioner, and people can go like, "Oh, this doctor is not really qualified. This doctor speaks a very funny kind of language. This doctor is not coherent. This must not be a good doctor." Now this is a big danger, and I see people nod, yes, and it's not only true for doctors, it's true for every profession. So what can we do in order to help this? Well, there is different solutions. One solution that we see very often is that hospitals try to hire medical interpreters. They put medical interpretation in place, but it's practically not always very easy. Sometimes they use cultural mediators, that's professionally trained people who try to help the professional understand what the patient wants. But more often than not, we see that these medical interpreters are not trained. We need a Bosnian. Oh, right, there's someone in the corridor. Let's quickly call them in and let's try to mediate because we have a problem here. Or a parent enters with a child. Well, let's use the child as a mediator. Very difficult situations. Another possible solution is individualized language training. And Sweden is, again, top of the bill here. Medical doctors coming to Sweden get individual training. Often it's a precondition to an appointment. But the question we have to ask ourselves is this effective? And how can we effectively respond to the needs, the communication needs of these mobile medical professionals? Well, there is different possibilities. And in this case, we did a needs analysis. We studied through questionnaires and interviews about 600 people, medical people across Europe. 226 of them were non-native speakers of the language. And we did that because we wanted to ensure maximal effectiveness, maximal efficiency for learning and training mobile medical professionals. We didn't want to do this in one way. We wanted to develop materials that were technology-based, but could be used in teaching, training, coaching, autonomously, however people wanted to do this. So I told you questionnaires and interviews, and there was people across 6 countries. So we tried to cover the different regions in Europe. We went north to Sweden and Denmark, we went south to Italy, and we went into the middle to Germany and good old Belgium, the little tiny country where I come from. Now, some marketing. What is Medics on the Move all about? Well, it's medical communication tools. And if you have to believe the marketeers, it's no nonsense, it's online, just in time, progressive, on the work floor, autonomous, it creates results, no hassle, multilingual and flexible. In my terminology, it sounds a little bit different. Well, why did we do it? Well, we did it in order to enhance effective professional functioning. And effective functioning, we've heard it several times today, it's not only about being a professional and being serious, it's also about being a person. It's about being social. It's about being able to share a coffee with a colleague. It's about being linguistically accurate. You have to be able to pronounce things well, otherwise communication won't work. And it's about being adaptive. You have to interact with the people around you. How did we do it? Well, we wanted contextualized language learning and language training. Doctors have no time to waste. They have to save lives, and everything else around them seems a little bit of a superfluous thing. I'm personally married to one, so I know what it is. So, contextualized. Let's get down to business. It has to be medical and no other things. And individualized, because doctors are individuals. And how individualized? Well, online. You have a desktop, you have a laptop, you have a palm top. iPhone nowadays, right? Or iPad. When we started, there was only BlackBerry, and we have to be very careful about terminology. It's multilingual. You can actually learn one of 6 languages. And when you are in Denmark, okay, you study Danish, there is Dutch, there is English, German, Italian, and Swedish. The backbone of every language is identical, but of course, how we speak and communicate in the different languages is different. And we have provided interface languages, because sometimes studying Swedish in Swedish, well, it's a little bit difficult in the beginning. And so we give interface languages. We give helping languages to access the materials for the beginners especially. Arabic, French, Polish, Romanian, Russian, and Turkish. And they haven't been picked at random. We studied why we wanted these languages. There is 2 different types of level. We work for people who have no or virtually no knowledge of the language, and we work for people who are on the work floor and want to improve their language skills, so advanced. How do we do this? The MoM components, well, first and foremost, the backbone of it all is scenarios. Scenarios that follow the patient-doctor consultation timeline, so it's very professional what a doctor does, but also more kind of business talk. How do you do hands-off with your colleagues? And also, how do you speak to head nurses, very important in Sweden, or to administrators, very important in Sweden, and also interactive, social. How do you solve conflicts with a colleague while drinking a beer? Very difficult in Sweden. We'll drink isvatten, right? So what we do is scenarios doctor-patient, doctor-doctor, but also doctor and other medical professionals, because there are many other medical professionals you have to deal with. We provide text, written, that's what people want in learning context, but we provide everything also in audio. And we give people the opportunity to listen to natural speech. I can speak very quickly if I want to, but I can also slow down. And people can themselves change the speed of what they listen to. We provide translations and we provide training. It's called exercises in pedagogic terminology. There is a library with word lists, and we have done a tremendous effort to provide what doctors need, actually everyday medical terms. They know Latin. Oh yes, they know it much better than I do. But often they don't know how a child will talk to his mother when it has got abdominal pain. The child will never say, I've got an abdominal pain, Mom. They'll go like, I've got a tummy ache, my belly aches, whatever. And the doctor has to understand this and maybe also speak to the child in a term like that. We've provided grammar, but not any odd grammar. We don't want doctors to be able to say, detta är gamla stan. No, they have to say, detta är abdomen, or something like that. They have to say something which is a medical context. We have done a lot of work on phonetics, on pronunciation, and a lot of work on medical communication, because as you may have seen on the slide, a lot of doctors come from outside of Europe, have been trained in maybe slightly different contexts. And the idea is that they also learn how communication is done in the Western world. So we have provided a support system which is generally recognized in the West, so that people also learn how communication is done and what is so specific about active listening and all this non-verbal talk and this body language and how close you can come to an Italian and how far you keep away from a Finn, all of that. But we try not to patronize. Doctors are really intelligent people. We don't have to tell them any stories. Fairy tales, that's when we drink coffee, right? So it has to be serious enough. And we also provide support system. We want them to also social-culturally link to what is medically available. Doctors have to know where patients find information on the internet. Doctors have to know what other language learning materials are available. And we provide them system help, of course, because not every doctor is computer literate, so we have to help them to work with computers. Now, we have the 6 languages, and it's online. And when you take one of my Triforces, you can immediately go and explore this for yourself. This is a little bit what it looks like for the basic. The basic MoM, Medics on the Move, is divided up in 10 topics. So you see 10 topics there, you see a system help, and you see a library. And for every language, it is in the target language. So in Swedish, it's in Swedish, but you can click a button and then you can see it in Arabic, or you can see it in French if you want to practice your French, or if you happen to be French. And under every button, you have scenarios, you have the training, you have the phonetics, the grammar, the manual. That's what it is. This is Dr. Miriam, and she helps you en route. So she gives advice to people in how to work and how to learn. We hope with Medics on the Move that we help doctors to survive their daily life. We hope that doctors don't get headaches when speaking to elderly patients who happen to speak without their dentures and speak a dialect which has almost died. We hope that we help doctors to communicate with 3 or 4 colleagues at the same time who are very boisterous and lively because it's Friday afternoon. We also hope that we can help doctors to communicate when they have to present cases in staff meetings, when they have to answer questions in staff meetings. We also hope that we help them communicate when their supervisor asks them how the weekend has been, and that they don't die because they don't know what they did with the weekend. So we hope that really the circle can be round by providing them access to a complete and full life. When we look at it again in a more theoretical way, this is what the system looks like, but Flika is waiting. So these are the project partners who actually helped realize this in the last 5 years. We had pedagogical and content developers, intercultural communication consultants, test designers, because of course we tested every step of the project to its finest details, and technical developers, one person Swedish, one team in Sweden, of course. And of course we have to be very grateful that the European Commission has sponsored this project twice in the course of its existence. Medics on the Move hopes to bring the world of medical professionals a little bit closer to the world of their colleagues and their patients. And if you want to get in contact with us, please go and have a look at the website. Thank you very much.